My name is Ryan Smith, and I'm a urologist at the University of Virginia, specializing in male infertility. I was born and raised in Indiana, which was really an ideal place to grow up as a kid. I was surrounded by my extended family growing up, which had been a blessing to me throughout my entire life. In particular, my grandfathers, both of whom fought in World War II, really stressed to me the importance of family. Both of them, after they came back, had very little, but yet sacrificed everything for their families, and really instilled that spirit within me. I thought I would be a professional athlete, but then I also had a great love of reading growing up, and many of the things that I read were related to science, from astronomy to paleontology to genetics, and that really instilled in me a passion, not just for reading, but for science and the possibility that science brings to the world. And I remember reading a book called The Dinosaur Heresies by Robert Bacher, which really inspired me to want to do paleontology.
The further we probe into the universe, the more...
And that was followed by reading A Brief History of Time by Stephen Hawking, which after that I was sure I wanted to be an astronomer. And then as I was growing up, genetics became very big, and I remember distinctly the first sheep Dolly being cloned and just being fascinated by that. And
her name is Dolly, 7 months old. She may not be the monster imagined.
In many ways, I thought that I would be a scientist and study biology. And when I was a child, I spent a lot of time outdoors and was fortunate to have the landscape of Indiana to inspire me. And so that really led me to pursuing science and biology. So I wanted to come back to the University of Virginia after training here for medical school and residency because we really wanted to return to this community where actually our third child was born very premature at 27 weeks and was hospitalized at the University of Virginia. My wife was very ill as well and was in the hospital during that time. And you know, the care that we received and that our son received during his time in the NICU here at the University of Virginia was amazing, and it's really a credit to their care that he's with us today. And it really inspired us to want to come back, to be able to serve this community and to be a part of the university and hopefully help other families and their loved ones as they go through illness, whatever that might be. You know, as an infertility specialist, most of our surgeries and our interventions require an operative microscope. So we're operating on things that are, in some cases, millimeters wide or even smaller, and some of the stitches that we're using are very, very small, and which can be technically challenging and require a very exacting approach. And so that's the reasoning why we do additional training to be able to do that. And it's having watched the science advance over the years, it's pretty profound what we can do and intervene now for couples, which in the past, we may not have been able to offer them anything, but now even patients who may have no sperm, there are treatments that we can do to help to find sperm for those couples, to help them if they wish to pursue having their own children. So it's been a privilege to be a part of that science and to help and watch it develop, and also now be able to offer that to patients. One of the biggest advancements that we've had over the recent years have been in patients who don't have sperm but may have it present in the testicle itself. And now we're able to, using an operative microscope, actually open the testicle and identify single tubules there that may harbor sperm. These men who otherwise have no sperm present when they perform a semen analysis. And that's been one of the greatest advancements in reproductive medicine, as far as being able to use very few numbers of sperm and being able to find these small islands of sperm production within the testicle to be able to help couples conceive and start families of their own. For me, it's essential, the connection that one establishes with their patients. Given my family's experience with infertility makes this relationship more personal and more intimate. Looking at my patients is like looking at myself and my family not long ago. What better place and what better setting to serve than the University of Virginia in Charlottesville, with its culture, its beauty, and its people. My family and I are here to serve this community in the same spirit that my grandfathers served in World War II. It's very simple. It all comes down to this. It's our faith, our family, and our community which shape our lives and ultimately our future.